Hello and good morning. This is Dr. Yonette coming to you again with another episode of Baby Talk. I know it's Friday and you're excited. It's going to be the weekend. You'll have time to sleep in and relax with your baby and just do some more journaling and really spending time with your child as he or she grows and develops. Today, I want to go back to one of the topics I started some time ago, I think it was in June, and that's the topic of autism. There are lots and lots of children today who are born with autism or experience autism. And let's recap and look at what we said autism was. Autism spectrum disorder is really a developmental disability, and it's caused by differences in the brain. Now, doctors can look at your child's developmental history, and here again, where journaling is very important, and the kinds of behaviors that your child is demonstrating, and then make a diagnosis. Now, these signs begin before the age of 3. So if your child is going to end up with a diagnosis of autism spectrum disorder, he or she must have those signs before the age of 3. And within the first 12 months of life, some children begin to show these symptoms. In others, the symptoms might show up until 24 months of age or even later. And then some children with ASD or autism spectrum disorder may gain some skills and they meet their developmental milestones as indicated, and then around 18 to 24 months they begin to stop gaining skills and even lose the ones that they had before. So generally what you're looking for in your child, if you're suspecting that your child has autism spectrum disorder, you are looking for the child not responding to his or her name. When you say Henry or Ben or Sabrina or Carol or Jane, there's no response. It's like you're calling out into thin air. And then your child does not make eye contact. When you go to play with your child and say hello, your child is not looking at you. The child is not making eye contact. So let's talk about, in more details, let's talk about the treatments that are available for children with autism spectrum disorders. And I want to indicate here that there's no cure for autism spectrum disorder. But what the treatment does is to reduce the symptoms that interfere with the child's daily functioning and the quality of life. Okay? So, and because autism spectrum disorder affects people or children in different ways, that means that children may demonstrate unique strengths and unique challenges. Different treatments will be given to different individuals. So there's no like one tailored treatment for everyone, because everybody demonstrates the condition in different ways. So treatment is usually planned around the use of multiple professionals, and the treatment is geared towards the individual. Here are the areas that your child might receive treatment in education, in health, in community or home settings, or a combination of the community and home setting. It is important, though, that whoever is providing services, treatment for your child, that team of providers collaborate. The team of providers need to collaborate. The family needs to be involved so that everybody is aware of what the goals are of the child and making certain that these goals are being met. As an individual with autism spectrum disorder might continue to get services throughout their lifespan. even after they exit high school and to grow into adulthood, services or treatment might be provided to help improve that individual's social and community engagement, and supports in job training and finding employment and securing a home and transportation might also be provided. And I want to interject here that this information is based on directions of the CDC, and I want you to bear in mind that as we discussed this morning, that you should feel free to look up, go search up on the internet information that is relevant to your child that will be the best treatment for your child. All right, so there are many treatments available, and I want to talk about 1, 2, 3, 4, 5, 6, 7, 8 types of treatment that you can look into for your child. The first type of treatment I want to look at is the behavioral approach. Now, behavioral approaches focus on changing the behaviors that your child is demonstrating. It focuses on understanding what happens before and after the behavior. And so you may have heard about applied behavioral analysis. This is a very common strategy or approach used with children with autism. And ABA, or applied behavioral analysis, encourages the desired behavior and it discourages undesired behavior to improve a variety of skills. And they professionals who provide applied behavioral analysis track the child's behavior and work very closely with a child with autism to help him to demonstrate what is quote unquote called normal behavior. Now, there's also what we call the developmental approach. And the developmental approach is what I've been talking about all the time. Your child achieving developmental milestones. Now, with the developmental approach, focus is placed on helping the child develop specific skills, such as language or physical or a broader range of developmental abilities. So, under this approach, the most common service or treatment that a child receives is that of speech and language therapy. And speech and language therapy is given to help the child be able to communicate and to interact with people verbally. The child under behavioral or developmental approach rather also receives occupational therapy. And that's where I come in, where I work with children with autism to help them live as independent as possible. I also work on skills such as dressing and eating and bathing and relating to people and using tools like in a school setting. Now, one of the big things in occupational therapy when it comes to working with children with autism is providing sensory integration therapy to help those children improve their responses to sensory input. Because a lot of children with autism have a lot of aversions. They can't wear certain clothing. They're very picky eaters. Noise affects them significantly and in a much different way from how people who are developing normally respond to noise and all the sensory inputs that come into them. Another approach used in this area is the physical therapy. And physical therapy would help the children to use their gross motor skills or their large muscle skills to move and play and interact in their society. Okay, so let's move on. The educational approach. Schools today have special programs for children who have autism. I mean, a child with autism may be lacking in some skill areas when it comes to education, but they may thrive in other areas. So schools create specific programs to help these children through a daily routine, and so the child knows exactly what to expect at each time of the day, and through visual instruction. So the approach from an educational perspective is to use a daily consistent routine and visual learning or visual instruction. Then we also have the social relational approach. And this approach really tries to help to improve the child's social skills and build emotional bonds, because children with autism tend to just be in their world. They exist in their world, and everybody else is really invisible. So you want to use this social relational approach to teach the child social skills. Now, as I said earlier, there is no cure or no medication that will cure autism spectrum disorder, but there are medications. So from the pharmacological approach, there are medications that are used with children with autism to help them to manage or treat co-occurring symptoms. You know, children with autism may have difficulties with focusing. They may end up engaging in self-harming behaviors. They may have high energy, always on the go. You may see a lot of hand biting and head banging. And, those symptoms are what you really focus on in terms of pharmacological approaches, so that you can help the child with anxiety and depression and other medical conditions like seizures and sleep problems and stomach and other problems that they may experience. And then we have what we call the psychological approach. And the psychological approach would help the child with coping with anxiety and depression and other mental issues that the child with autism may experience. Now, there are some parents who do what we call the complementary or alternative treatment approach. And for these parents, they look into things like food. They put their children on special diets, herbal supplements. They do chiropractic care. There's like animal therapy, art therapy, mindfulness or relaxation therapies. And individuals and families should be encouraged, to talk with their doctors before starting this alternate or complementary treatment approach. But, treatments are available for people with autism spectrum disorder. And if your child is already in school or under the care of your city, if the child is 0 to 3 years old, where he or she's receiving services from early intervention, you want to continue to work with a team so that your child is getting the best services so he or she can develop those skills needed to be successful in life. A child with autism is a blessing to you and your family, and you have a specific responsibility to raising that child in a way that would bring fulfillment and satisfaction to him and to the people in his community. So moms and dads, as you work with your child, know that you have lots of support, lots of treatment options that are available to you. I want you to explore them and get the help you need. This is Dr. Yonette saying take care of baby and take care of you.